Today, we're going to talk all about sleep. Now, why is this such an important topic for this community? First, we know that sleep is linked with restoring the immune system, restoring the neurologic system, and repair and restoration of the skeletal system. But beyond that, we know that sleep is also linked with improved mood, improved cognition, improved memory, and overall improved health. But even more importantly to all of you is that sleep has also been linked with positive neuroplastic changes after a stroke, improved outcomes after a stroke, and decreased risk of stroke reoccurrence. So in this video, we're going to do a deep dive into what sleep is, what's going on inside the body while we're sleeping, what are some signs that you might be sleep deprived, as well as how sleep deprivation impacts almost every system in our body, and of course, practical things that you can do today to improve the overall quality of your sleep and the duration of your sleep. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injury, with the end goal of empowering you with as many tools as possible to reach your highest maximum level and improve your overall quality of life. And with all that said, I consider today's topic probably one of the most important topics to talk about in the context of stroke recovery and or those of you that have any type of neurodegeneration. In the past several weeks, I've been finding more and more evidence as to how many systems in our body are impacted when we're not getting good quality sleep. And on the flip side, all of the benefits that happen inside our system when we are getting good quality sleep. So big picture, let's just start with the foundation of what sleep is, or the definition of sleep. Sleep is the natural, easily reversible absence of wakefulness and by the loss of consciousness of one's surroundings. So the key words in there are the natural, easily reversible periodic state of the absence of consciousness. And that will be important when we get a little bit deeper into this topic of sleep. And still sticking big picture, this periodic state of the loss of consciousness is divided up into stages. These stages are non-REM or non-rapid eye movement sleep and rapid eye movement sleep. And we basically kind of go through these stages throughout the night. During non-REM sleep, we're kind of falling deeper and deeper into sleep, with the last stage of non-REM sleep being the deepest sleep, and we call that slow wave sleep. And then that's followed by rapid eye movement sleep, which is a state of arousal similar to when we're awake, but there are some subtle differences, and we'll get into that as well. So non-REM sleep is basically going from 1 to 3. We're getting deeper and deeper into sleep. There's not a whole lot that goes on as far as bodily functions in stages 1 and 2, but the golden ticket is that stage 3 sleep, non-REM sleep, which is the deepest sleep that we encounter throughout the night. As I mentioned, this is also called slow wave sleep. During non-REM sleep or N3 sleep, our muscle tone decreases, our pulse rate decreases, and our breathing rate decreases. Other key characteristics of this stage 3 non-REM sleep is that 90% of growth hormone is released during this stage of sleep. Our body shifts from primarily sympathetic to parasympathetic, so we have a change in our autonomic nervous system. So again, just to review for some of you, sympathetic is that flight or fight system, and parasympathetic is what they call that rest and digest part of the autonomic system. So we're going from that fight or flight system into that parasympathetic or that rest and digest system becoming more active. And again, this is the deepest sleep we will experience throughout the night. And this accounts for 10 to 25% of the sleep cycle. Now, after that deep sleep, our body transitions into what we call REM sleep. REM sleep accounts for approximately 18 to 25% of the sleep cycle. This stage of sleep, we're the most alert, and it's very similar to being awake, with one big difference that our muscles are pretty much paralyzed with the exception of our eye muscles and our breathing muscles. Unlike the deepest part of sleep, during this stage of sleep, the heart rate increases. They also believe that REM sleep is integral for procedural memory and the memory of motor skills. One other key difference with this part of sleep is that the amygdala becomes active. And when we get into some of the benefits of sleep, I'll go into this a little bit more. But the amygdala is basically, or is for the most part, responsible for kind of processing emotions. So that's another key difference with this stage of sleep. And we usually don't hit REM sleep until we've been asleep for about 90 minutes. Now, those are the stages of sleep, and each stage lasts, or each cycle of stages lasts from anywhere from 90 to 120 minutes, and we cycle through that about 4 or 5 times a night. Now, what drives this system, or what drives us to go into this unconscious state? Well, first, let's just get underneath the skin real briefly and real big picture. There are several brain areas involved, primarily the brainstem, the hypothalamus, the cortex, the forebrain, and then there's also some activity in the thalamus and the amygdala, as I stated earlier. So all of these brain areas, for the most part, are in constant communication with each other to keep us awake during the day and to keep us asleep at night. And then on top of that, we have neurotransmitters. So neurotransmitters are basically chemicals that allow those brain areas to communicate with each other. So areas of the brain that can't speak in a language, so instead of using spoken language, it simplified, they use neurotransmitters to kind of communicate with each other. Some neurotransmitters are excitatory, and they will turn on a nerve to send an impulse to another brain area, and sometimes, in some cases, communicate that that brain area now needs to do something. And in some cases, neurotransmitters are inhibitory, in which case a nerve impulse is kind of shut off, or that communication stops, which also does have its own kind of cascade of events when one brain area does this or sends an inhibitory signal. So the excitatory neurotransmitters that's good to be familiar with if you care about this topic of sleep are the excitatory neurotransmitters, which include norepinephrine, serotonin, dopamine, and histamine, and then inhibitory neurotransmitters, which include GABA and adenosine. And we're going to go in a little bit further into kind of what those neurotransmitters do a little bit later, but it's just good to know that excitatory neurotransmitters turn a brain circuit on. Inhibitory neurotransmitters, for the most part, generally speaking, will turn kind of a neuro circuit off. And then there are also hormones involved that either keep us awake during the day or help us to sleep at night. And those are melatonin, which a lot of you are familiar with, that helps us with our sleep drive or that pressure to go to sleep. Cortisol aids in alertness, and then there's other hormones that are just regulated during sleep. The important ones to know are leptin and ghrelin, and we'll get into what those are. But the big key ones that play the biggest role with arousal and going to sleep are cortisol, keeping us awake, and keeps us in that state of unconsciousness. Now, why is all this important? Primarily, knowing that there's so many neurotransmitters and hormones involved and brain areas involved, it's really, really critical to understand this, because if you've had damage to your brain or you are in the midst of or dealing with a neurodegenerative condition, in my mind, I don't think there's any way that some of this system is not possibly slightly impaired. And so I feel like doing a deep dive or having a better understanding of sleep in general could play a critical role in your recovery, but also might be important if what areas of the brain that are involved with you could potentially be causing some sleep disturbances or causing some sleep inefficiency. And we'll get into what that is a little bit later, but just something to be aware of. So now we've gone into kind of the definition of sleep that we're going to stick with for this video, the stages of sleep, some of the behind the scenes of what's going on in our body when we're sleeping. But now the big question is, how is sleep regulated? What allows us to stay awake during the day and fall asleep at night? And I promise you, this is really important, especially when we we get to some of the lifestyle modifications or some of the lifestyle things that you can do to help to make sure that you're getting that good quality sleep. But what exactly regulates this system? So I talked about those neurotransmitters, and if you can envision kind of like a switchboard from the Little House on the Prairie days, I just visualize that switchboard operator turning all the phones on and off. I kind of visualize that that's what this system looks like, and there's switches going on and off, turning neurotransmitters on or brain areas on and off by releasing certain neurotransmitters. The only difference is there is no human controlling that switchboard. So in place of that human, we have other systems or cues that our system is getting to help regulate or be the one to help tell the brain what areas need to be switched on and switched off. And again, we're still sticking really big picture and keeping this extremely simple, but we have external cues and we have internal body cues. Some of the internal cues are we have an internal body clock that matches up with the circadian rhythm. The circadian rhythm is a 24-hour cycle that's based on the sun. And then we have something called sleep homeostasis. So it's just a built-in system that the longer we're awake, the more drive there's going to be for our brain to make us fall asleep or transition our brain and our body from a state of wakefulness to a state of natural unconsciousness. Now, both of these systems are influenced by light. So light stimulates a part of the hypothalamus that actually activates what they call like our ascending arousal system, which keeps us awake. And that's going to become important again when we get to some of the lifestyle things that you can do to help you stay awake. That is probably, I would say, probably the most important. These two systems or this internal body clock is also influenced by social activities, meals, and our work schedule. And generally speaking, our body is designed or kind of set up to get 7 to 9 hours of sleep in every 24-hour period. So now that we kind of understand these internal body clocks, I want to talk about sleep drive for a minute. So whether it's based on the circadian rhythm or the sun, or it's based on the sleep-wake homeostasis, there are some internal processes that are going on that increase our drive to sleep. So increase the body's natural tendency to want to fall asleep. And one mechanism that's in place that does this is our brainstem releases GABA. So I mentioned earlier that GABA is an inhibitory neurotransmitter, kind of turns off that system, that arousal system. So that's one way that drives us to want to fall asleep or our body to go unconscious at night, preferably. The other kind of mechanism that's in place is adenosine. Adenosine is a byproduct of cellular energy metabolism. So when our cells are very active, they are releasing this adenosine. Adenosine also drives us to sleep. So adenosine is typically very low in the morning and builds up throughout the day. So that drive to fall asleep or to naturally go unconscious is strongest after you've been awake for a prolonged period of time. And the other thing a mechanism that helps to naturally drive our body into a state of unconsciousness is melatonin. Melatonin release is primarily dictated or activated by darkness. So lots of light coming in through our eyes, melatonin secretion decreases. As there is more darkness in our eyes, melatonin increases. So not that I'm telling you anything new. If you've been watching any type of news or anything, this is a big topic, but screen time at night, that's one reason why that could disrupt your quality sleep at night. So those are kind of the systems in place or the mechanisms that help us to fall asleep. So again, that is extremely big picture. That is not really giving all of the nuances that go into sleep. I might do a little bit more. If you guys are interested in this topic, into the different brain areas that are involved in kind of the ascending arousal system and that sleep drive and kind of what's going on and what helps us to fall asleep if you want. But put in the comments if you want me to do a part 2 and I'll go into that system just a little bit deeper cover in another video. But again, big picture, why does all of this matter? Well, all of this matters because sleep impacts every function of our body. In particular, or primarily, the ones that we're going to go over today are how sleep, good quality sleep, impacts our mood, impacts our cardiovascular system positively when we're getting adequate sleep, regulates our blood sugar, hugely important in maintaining a healthy body weight and maintaining the health of our blood vessels, brain plasticity, which I know is hugely important to a lot of you that watch this channel, immune function, and as I even stated earlier, maintaining a healthy body weight. So let's start with improved mood. So how is sleep and mood kind of associated with each other? Well, first and foremost, if any of you have ever been sleep deprived, you know you're a little bit more on the grumpy side. At least I know I am. But beyond that, sleep helps our body to restore, so obviously that has a huge impact on our mood. But even more than that, they know that the amygdala is pretty active during that REM part of sleep, which I had mentioned earlier. So potentially another way that positive mood or a healthy mood is associated with good quality sleep is that maybe we're processing our emotions a little bit more during that REM sleep. They do know that people that have psychiatric disorders or have depression or anxiety, those things, they've done sleep studies on people that are dealing with those kind of mood disorders, and they know that they are sleep deprived primarily. They're missing REM sleep. Moving on, how is sleep associated with having a healthy heart? Well, slow wave sleep, as I mentioned, that's that N3 or that non-REM stage 3 sleep, also called slow wave sleep. During that stage of sleep, our heart rate decreases, which I said earlier, our blood pressure decreases, which I said earlier, and our breathing rate decreases. But the key characteristic of this stage is we switch from that sympathetic system to our parasympathetic system, which is that rest and digest. And possibly just being able to allow our blood vessels to rest helps them to restore and repair so that our smooth muscles in our blood vessels and our heart maintain their structural integrity and perform optimally. The other way or reason that we know that a healthy heart is correlated with good quality sleep is there is a lot of evidence that suggests that poor sleep quality or sleep deprivation increases the risk of cardiovascular disease by 63%. Sleep also regulates our blood sugar. And at best guess, the mechanism behind this is that we release insulin while we're sleeping, and insulin promotes glucose that's in the blood to go into the cells. Without insulin, glucose just sits in the blood. So lack of sleep means that there's decreased insulin production, which increases blood glucose. Now, they've done studies on this in healthy individuals and as little as 3 nights of sleep deprivation, and those healthy individuals showed signs of insulin resistance. Now, brain plasticity, probably the reason that the important reason, or the reason that I think this video is so important to all of you, because I rarely hear patients talking about, their doctors talking about sleep. So that's what really got me to do this deep dive into this. And the further I went into it, the more I realized how valuable this is, and kind of was shocked that I don't hear more doctors talking about this with patients that have had a stroke or are living with a neurologic disease. But we know, or the scientists know, or the data shows that slow wave sleep is associated with memory consolidation. In other words, when someone practices something during the day, there is data that shows that those same brain areas are reactivated at night. One study that I found on this, where they did look at 2 groups of people. One group of people, they gave them a task, a learning task at night, and gave them that same task in the morning. And then they gave a group a task in the morning, and they gave them that same task at night. And the group that had the sleep in between the 2 sessions actually performed better on that second session versus the other group, which had like a restful wakefulness in between those two sessions. So that's a little bit of evidence that suggests that there is something going on during our sleep that helps to consolidate those memories and helps with motor learning. Just a side note, with that experiment, it was a motor task that they gave the two groups. But beyond that, there are other things that we know about sleep, such as the release of growth hormone, which also helps in all areas of our body, but especially in brain health and repair and healing and cognition, as well as other cells and tissues in our body. So there's plenty of different mechanisms that are out there as far as potential theories of what's going on with our sleeping, while we're sleeping, that further drives home my opinion that I think taking sleep seriously and really focusing on getting good quality sleep is so important. The other area that is hugely influenced by our sleep is our immune function. So the researchers or the scientists show that while we're sleeping, we increase our immune cell production. The part of the theory or the rationale that is believed to be why this happens at night is, one, it's kind of like when we're sleeping, our body can kind of shift resources, so we can build that immune system up. Now, I know what you guys are probably thinking, because I just did a video on the immune system, that, isn't it bad to have immune cells releasing? And in this case, what they think or they believe is happening is it's kind of like you have cells that deploy to fight something. So that'd be like your military going into battle. But then you also have cells that are going out there to train. And so they kind of think that these immune cells are just gathering data and just making our immune system more robust when they're acting at night. The other theory or mechanism that I found as to why this might happen at night is they believe that melatonin has a neuroprotective effect. So because we release more melatonin at night, which helps us to fall asleep, that is another reason potentially why this immune system tries to do their training kind of at night. So those were two different papers that I read as to why this might happen, or why we might have this increased release of immune cells at night. And then the last, not the only one, this is not all inclusive, but the other area that I think is important as far as why sleep is so important to our bodily function is maintaining body weight. And that really has to do with two hormones called ghrelin and leptin. Ghrelin is a hormone that is released from our stomach and kind of sends a signal to our brain that we're hungry. So the way I remember that is just ghrelin is like a grumbling stomach. And then leptin is released from fat tissue and kind of suppresses ghrelin. So it doesn't want your body to be hungry if it knows it has stored fat that it can use. And while we are sleeping, they have found that acute sleep deprivation increases the release of ghrelin. So basically, telling us we're hungry when potentially we're not needing energy. And then chronic sleep deprivation suppresses leptin, basically, again, not telling our body if leptin tells our body that we don't need any more energy. If leptin is suppressed, then that's going to tell our body possibly that we need more energy. The other potential reason that we could gain weight, the people that are sleep deprived gain weight, is because you're awake more hours. So there's just more hours in a 24-hour period to eat. So your caloric intake is higher. Those are some potential reasons why they know there is a strong association between sleep deprivation and obesity. So now we know what sleep is. Hopefully, we know what the stages of sleep are. We know the positive impact that sleep has on our body. Now let's go into sleep deprivation and sleep deficiency. Sleep deprivation is basically just decreased duration of sleep, meaning the number of hours that you are in bed is shortened, meaning under that 7 hours. And then there's sleep inefficiency. So sleep inefficiency is characterized by fragmented sleep, meaning that you're having these spikes or these arousals throughout the night, or inefficient sleep means that you're getting less sleep than the number of hours you're in bed. So if sleep deficiency is decreased number of hours in bed, sleep inefficiency, in addition to those frequent arousals, is when you're in bed, but your sleep duration or the amount of time that you're actually asleep is shortened. Some of the symptoms that are associated with sleep deprivation are slower thinking, reduced attention span, memory problems, risky behaviors has also been correlated with sleep deprivation or showed to be linked with sleep deprivation, lack of energy, and mood changes. Depression, anxiety, irritability, and an overall reported mental stress. So in addition to kind of the problems that I went through when I talked about the benefits of sleep, when sleep is deprived, how those systems break down a little bit, in addition to that, they also know that pain is linked with sleep deprivation, meaning that people that experience chronic pain also report sleep deprivation. And the other problem with sleep deprivation is diabetes. And we kind of went into that when I went into the blood sugar control, but that is also closely correlated with sleep deprivation or sleep inefficiency. So now, bringing it back to most of you that have had a stroke, why is this such a problem with stroke? Well, we know there's a 50% higher chance of having depression after a stroke, but beyond that, it will impact your ability to participate in your therapies, your ability for recall or memory consolidation when you're learning all of this new information. But they also know that people who have sleep disorders have worse stroke outcomes and a higher incidence of stroke reoccurrence. So how do you know if you have sleep deprivation or you have inefficient sleep? Well, one is to ask your doctor for a sleep study. Now, I will tell you this video is not to scare you. It's just to make you aware of certain things to have a discussion with your doctor. Most of the evidence suggests that if you have a sleep disturbance or a sleep disorder that resulted from your stroke, meaning that your stroke may have contributed to a sleep disorder, it'll usually be in the acute phase and resolve. So just something to keep in mind. But on the flip side, there is a strong link or correlation between sleep deprivation and stroke. So if you're someone that maybe you believe that maybe you didn't get good quality sleep before your stroke and you've never had a sleep study would be a great way to know if you have inefficient sleep. But some other things that might be indicators that you're not getting good quality sleep is if you snore, if your mouth is dry in the morning, that means you're primarily a mouth breather. Sometimes that indicates that you're not getting good quality sleep, acid reflux, and a history of stroke. So now, if you know that you have a problem with your sleep or you maybe want to improve your quality of sleep, hopefully I've convinced you that this is enough compelling information for you to pay more attention to your sleep. Listen, in preparing for this video, I have made probably 5 or 6 different changes in my daily life to improve my quality of sleep when I read all the benefits to sleep. So hopefully I've compelled some of you as well to give this a strong look to improve your overall health, but to also improve your recovery after a stroke. But what are some things that you can do to improve your overall quality of sleep? One is to have a consistent sleep schedule, including on the weekends, meaning going to bed at the same time and waking up at the same time. Remember I talked about those internal body clocks? They like routine. Our body processes better. If you can think of it this way, probably all of those systems, those internal body clocks and responding to external cues, it's kind of like an algorithm, and it's almost like we have backup systems to backup systems. So we have 3 or 4 different ways that our body tries to integrate information so that if one system's not working well, another one will kind of kick in and produce that drive to go to sleep. But being consistent means that there's not as much error going on. So if you go to bed at the same time, you're getting that kind of circadian rhythm kind of into a flow, as well as that sleep-wake homeostasis. So going to bed at the same time and waking up at the same time every single day, 7 days a week. As far as your room is concerned, They suggest to keep it as quiet as possible. This probably has to do with our flight or fight system that is back in Stone Age days or historic days when we had to protect ourselves from predators, that engages your sympathetic system, which is that fight or flight system. Stimuli, so sounds and things like that that are unfamiliar, probably stimulate that system, even if it's not fully waking you up where you can remember it in the morning. So they say to keep your room as quiet as possible. You want to keep your room as dark as possible. This includes night lights. And I actually used to have a clock before studying for this or before preparing for this video that was so bright. The numbers on it almost kind of lit up my room. So I no longer have that alarm clock in my room. So I'm taking this very seriously and having complete darkness. So darkness will increase that release of melatonin. We talked about that earlier. Melatonin helps with getting you into that natural unconscious state. Have a relaxing environment. So that again will take you out of that sympathetic system and kind of drive you into that parasympathetic system, out of that fight or flight and into that rest and digest system. So as much as you can. And then along those same lines, not having any technology in your room. So those devices are associated with being awake and aroused and being in ready mode or learning mode or work mode. And remember, I talked about those internal body clocks, and some of the cues they get are from our work schedules and our habits or our social schedules. So there is some outside influence from our behaviors that influences this internal body clock as well. So no technology in the room. I'm working on this, so I promise you I am right there with you if this one's going to be a hard one for you, because it's a hard one for me. Other things that you can do is to avoid large meals at night. Again, our food schedule also dictates whether or not we need to be awake or asleep. So if we have a lot of food in our stomach, it kind of triggers our arousal systems because our body kind of thinks that we need to be awake. There's something we need to do with that energy. So try and stop eating 3 hours before bedtime. Avoid caffeine after 2 to 3 o'clock. Caffeine blocks that adenosine I talked about earlier from doing what it needs to do, which is what helps us to fall asleep at night. So when you do that, you're decreasing that sleep drive or that ability to fall asleep. So no caffeine after 2 or 3 o'clock, no alcohol. They have found that in healthy individuals who drink alcohol, that disrupts REM sleep. And remember, REM sleep is really important for memory consolidation and learning new motor skills. So try and avoid alcohol. And the other thing is exercise. Exercise is important for so many reasons. I know I've talked about it before, but it definitely helps with stress and anxiety, which could be some reasons why you can't fall asleep and stay asleep at night. It's just that your mind is racing. So it definitely helps with that. But beyond that, I also think it helps with that sleep drive, because what I think is there's more adenosine, which builds up through cell metabolism. I just think exercise probably influences that whole system, and again, increases that sleep drive. And then sunlight. Get sunlight first thing in the morning. Direct sunlight on your skin without sunglasses for about 10 minutes. This does a bunch of things. It increases that arousal system and potentially influences that sleep homeostasis. So remember, as soon as you wake up, your body is slowly increasing its drive for sleep throughout the day. So by getting that sunlight first thing in the morning, it's kind of like you're getting that system going early, and so that you will have that sleep drive, or you'll want to fall asleep at night. So sunlight early in the morning, super, super valuable. And then that is it. I hope you guys found this video helpful. I probably am making this video partly because I found it very interesting when I was reading all of this, and I thought all of you might find it interesting as well, and that hopefully you'll take some of these things into consideration. And even if it just helps that 1%, we got to look for all of those little 1% areas where we can really improve that synaptic plasticity or that brain plasticity. And this could be one of those areas. So hopefully you found this helpful. Hopefully with a little bit of background information, it'll help you to kind of make the choices that are going to be best for you given your situation. If you have any questions, definitely leave those in the comments below. I enjoyed spending time with you all today. If you have questions and you would like, you can join our live sessions, which we hold once a month for just $5. Link for that is in the description below, and then you can get your specific questions answered. If you want exercises throughout the week, you can head on over to Instagram and join us over there where I post 1 to 2 videos every single week. I enjoyed spending time with you all today, and I look forward to seeing you in the next video. You all have a good day.